Hi, I'm Dr. Danistrad from the Danistrad Clinic, and we're here to talk about rhinoplasty today. A rhinoplasty is a medical term for what a layperson would call a nose job. When patients come in for a rhinoplasty, they're usually asking to change the profile of their nose or remove a hump off the top of the nose, maybe make the tip smaller, or straighten a crooked nose. The number one complaint patients have when they come in for a rhinoplasty is that their nose is not the nose they think should be on their face. They want a nose they've always envisioned in their mind, and that's my job to try to create that for them. So I will see patients who either are relatively young in age, usually 16 to 20 years of age, about to go off to college and wants a new nose before they start their new life, or I will see a patient a little bit later on in life who's always wanted one but never had the means to accomplish it. And occasionally I'll see a patient who has had some sort of a traumatic event and now wants their nose back to the shape it was. In general, rhinoplasty procedures are performed under general anesthesia. They can be performed either in an open fashion or in a closed fashion. Open fashion means that there's an incision to get into the structure of the nose, usually a small one just here under the columella, or closed rhinoplasty is done with incisions all inside the nose. Which technique is used depends on what the patient and the physician are trying to accomplish together. The cost of a rhinoplasty depends on whether or not it is a primary rhinoplasty, that means a first-time surgery, versus a revision surgery. Obviously, the complexity of the surgery also counts towards the expense of the surgery. A primary rhinoplasty can be anywhere between $6,000 and $10,000, and a revision rhinoplasty anywhere from $12,000 to $15,000. For most patients, there's some pressure associated with the surgery and some pain, which are easily taken care of with pain medications. I ask patients to leave their cast alone, make sure they don't get it wet, sleep with their back elevated, and use some sort of frozen peas or corn to keep the swelling down. In the past, patients would have much more complicated recovery in that first week, especially because of pain caused by the packing. I've completely eliminated that in my practice and do not pack patients at all. After a week following the surgery, I will remove the cast from a patient's nose and reveal to them their new nose. At the same time, if they have any sutures, those will be removed as well. They'll get a very good look at their new nose that first day. But in general, over the course of the next month to a month and a half, a lot of the swelling will slowly come down along with the bruising. To the patient, their nose will start to look like their final result somewhere around about a month and a half after the surgery. From the surgeon's perspective, I expect that it'll take about 6 months before I see what I expect from their nose. Rhinoplasty is not just a surgical change or a physical change for the patient, it's also an emotional change. Ultimately, what we're trying to accomplish is to give patients a break from the emotional deficit that they've had from their nose all these years. You also have to remember that the shape can change the function of your nose as well. That's why it's so important to consider a surgeon who is both trained in the functional as well as the cosmetic aspects of the nose. If you're interested in a consultation, visit our website or call 310-453-6500.